This podcast is meant for general health information and is not meant to override any medical advice. All questions will be screened and not contain any personal information. If you want a private consultation, contact us via positivechoice.org, or you can contact your provider directly. Thank you and enjoy the episode.
Hello, and welcome to the Positive Choice Wellness Podcast. My name is Melanie, and I'm an exercise physiologist.
My name is Kimberly, and I'm a registered dietitian.
And we have back again for the second time now. We have Miss Kate Hardy, who has a yay, and she has a master's degree in exercise physiology, like myself, which I appreciate. And she's also a lifestyle educator here at Positive Choice as well. So welcome back.
Well, thank you. Thanks for having me.
We're happy to have you back. We're so excited because Kimberly came to me. She's like, we have to have Kate on this episode. And I was like, okay. So
It's true. It's a
yeah.
great topic.
What is the topic?
Okay. Well, I shouldn't introduce the topic, but I will tell you, I had a personal conversation with Kate about this, and it has been very beneficial for me in my personal life as far as like mobility and stuff goes, because I have a lot of aches and pains, and she aided me.
Oh,
So hit us,
okay.
Kate. What is it?
I'm so glad to hear that that was helpful for you, Kimberly. That's great.
Yes, truly.
Well, I'm going to talk to you today about functional range conditioning exercise. And um, Kimberly had asked me about this because I had presented in one of our educator meetings about something I had recently learned about just by chance because I was subbing one of our educators class on arthritis. And I was happy to have been asked to teach this because I have arthritis myself and I have for 30 years. And I had never heard of these specific exercises. At the time, I was really struggling with my neck. And it just happened that the exercises for the day that I taught were for the neck. And at the time, I was looking at the notes and learning how to do this so I could teach the class. And I was unfamiliar with it. At the time, I couldn't move my neck at all. And then after doing the exercises, even going through them one time, my range of motion was increased measurably, very significantly. But it wasn't
Wow.
perfect yet after doing it one time, but it was a lot better. And
That's still
so
amazing. That's still
it
amazing after one time.
I know, it was amazing, and, so obviously I did it another time, and it continued to improve, and I think I did it twice a day for a couple of days, and then just down to once a
Mm.
day, and my range of motion is was almost normal within a couple of days,
Oh, wow.
and
Wow.
yeah, it was so bad before, I'm like, I was thinking, "This is very dangerous to drive like this, I can't even move my neck," and then I
Oh.
now I can drive, and I don't have to worry about getting in an
Yay.
accident, yeah.
Woohoo.
Yeah. So anyway, that's why I had been presenting this information at our educator meeting, and I was so excited about it, about learning about it, because I've had this condition for so long, and I've been to many like physical therapists and doctors, and nobody has told me about it before. And so I was all about telling everyone about it, which is why
Mhm.
Melanie and Kimberly invited me to talk about it today.
Yeah.
Yes.
Which is it's funny too, because I actually helped like edit some of those PowerPoints for what you subbed for with that
Oh,
instructor. So I learned about that from those PowerPoints. I actually had not heard of it prior to either. So this is also
oh,
new for me as
interesting.
well. Yeah.
Oh,
Yeah.
cool.
Yeah, that is really interesting. I mean, since then have looked it up and there's quite a lot out there. I'm like, does everyone already know this? But I don't think everybody knows this
No.
at all. I don't think very many people do. So,
I don't think
and
so.
I think Carrie said that she had learned about them because she was researching it for the class and she has arthritis. And so I really think I think these can be really helpful for a lot of people. And
Yeah.
yeah. So, shall I just talk about what it is?
Yeah, I mean, we've been vaguely referring to this thing, and everyone's sitting there like, "What is it? I don't
Yeah,
know.
tell
We'll
me,
never tell
tell
you." Ha
me.
ha! This is the end. Bye, everybody. No. All right. Let's explain. Let's tell people what this is.
Okay. Well, these specific exercises I'm talking about are called controlled articular rotations, and that the acronym for that is CARS. And so, if anyone is interested in looking it up on YouTube or something, you can search cars, and you will get a bunch of stuff on automobiles. So you actually have to put in controlled articular rotations, or you could probably put in cars for arthritis, and you might
Mhm.
get something different. Although I did that, and I found a bunch of articles on what car to buy if you have arthritis, which was
Of course.
okay.
Yeah,
So
helpful.
probably just controlled articular rotations might be your best bet.
Yes, yes, I think so. And so this is based on the premise that there's a difference between flexibility and mobility because we've all been taught to stretch our muscles or because
Mhm.
that enhances the range of motion within our joints.
Mhm.
But that doesn't necessarily enable us to be able to use our joints effectively within a full range of motion because we don't have the strength at those outer ranges of motion in order to be able to use them effectively. And
Gotcha.
yeah, yeah. So, functional movements are those that are used in biomechanics. Like if we're swinging a baseball bat or a golf club or a tennis racket, you can kind of imagine that you you're actually using the rotational plane then, but you also want to um, be able to have some strength behind that movement. So we can see how it would apply in athletics, but it also applies in something like just reaching up overhead to get something off of a tall shelf.
Mhm.
I don't know
I
if
was
either
thinking
one
that,
of
like, putting dishes
yeah,
away.
exactly. And if we don't have that range of motion to do that, it doesn't
Mhm.
seem ridiculous at all that we should be able to put the dishes away. You know, you reach up there and you do it, but then one day you do it, and if you don't have that range, and you actually hurt yourself.
Yeah.
Yeah.
Yeah, and so we do need to, challenge that range of motion and the strength within that range of motion.
Okay.
And yeah, so these functional movements usually work in multiple planes at the same time. So a plane of motion, there are three planes of motion. So we talked about the tennis swing and the golf swing and everything. Those are obviously in the rotational plane where you're twisting.
Mhm.
Mhm.
There's also the sagittal plane where one is moving backwards and forwards, and the frontal plane where one is moving side to side. And
Mhm.
so functional movements generally occur in more than one plane at the same time and occur at more than one joint at the same time.
Further proving that we're not in a 2D world. Yes.
Yes, yes, exactly.
I
We
love
don't
that.
move just straight forward and back and straight
Nope.
side to side. We have to be able to move in all different movement planes. So I guess mobility is really the combination of flexibility plus strength.
Gotcha.
So you can have flexibility without having very good mobility, but you can't have good mobility without flexibility. Okay, because you've got to have the
Mm.
strength at those end ranges of movement.
Mhm.
Let's see. So let's see. Risks of having poor mobility would obviously one's more likely to get hurt as they challenges those end range of motion, and might not realize you're challenging them. Whether you're in athletics or whether you're just putting away the dishes, you don't really realize you're challenging those range of motion until you actually get yourself into a position where you've injured yourself.
Yeah.
Yeah. So cars, how do they help mobility? Um, they actually utilize the active rotational movements at the outer limits of your range of motion. And each
Okay.
joint is um, you do the exercise for each joint independently, and you're supposed to isolate that joint so you're not moving um other joint you're not moving other joints or would be kind of cheating. So it means you're bringing other
Mm.
movements into play which you don't want to do. You want to isolate each one of these movements.
So, like, if we were to give an example of that, would it be like
Mhm.
rolling your shoulder around like this versus like leaning into it with your back and swaying from side to side to really get that big range of motion? Is that what we're talking about?
That's exactly what we're talking about.
Okay.
Yes.
Which I
You
said
want to,
like this, and no one can see what I just did. But I
I
just
can see
rolled my
what you
shoulder.
just did.
You can see it. None of them listening to this can see it. But I just did a circle with my arm. If anyone was curious what I just did.
Yeah, the whole point is you want to keep your whole body still except for the joint that you are moving. So,
Gotcha.
for
Okay.
instance, if you were doing one for the shoulder, say you were standing, you could do them standing or sitting, but say you were standing, um, you would keep your whole body facing straight forward, your hips pointing straight forward, and you want to make sure your hips stay facing straight forward as you move your shoulder through its whole range of motion, which if you don't think about it, you naturally do not do that. You move your, you
Mhm.
rotate your hips to accommodate a range of motion for your shoulder, and so that's part of it is just making sure that you isolate the joint.
Yeah, there's a lot of movements I think a lot of people don't realize I do simultaneously until we see people not doing it. Uh, like example, just a light example is when you walk, you sway your arms from side to side, and if you stop doing that, you look really weird. So,
And it
so if you
feels
want to
really
look
weird.
weird, don't move your arms.
Uh, that's right, and it feels weird too. It's
It
very
does.
inefficient if you keep your
Yeah.
hands straight by your side.
Yeah.
Exactly. So there's lots of little micro movements we make along with other movements. So it's a great point to make is like make sure you're really isolating that area and not using your whole body as we naturally would be inclined to do so.
Yeah.
Absolutely.
I feel like that just
Absolutely.
shows how you have to be paying attention, right? Because if you're subconsciously like just rolling through the motions of something, I'm gonna absolutely be twisting my whole torso if I'm like moving my trying to like maximize in my head anyway, moving my shoulder joint.
Mm-hmm.
So just having to be mindful as you do it.
Yeah, I think that's one reason that people benefit so much from a personal trainer sometimes
Mm,
is because we don't realize that you're not really controlling your movements the way you're supposed to unless somebody points it out to you. You know,
Yeah.
especially if you're not
absolutely.
trained to do that, which most people learn to do something else. They didn't necessarily learn to do that, and so it really I think does benefit people a lot of times to have someone point out any extraneous movements they might be making that are making their exercise less beneficial.
Yeah.
Mhm.
Which is a good
Yeah.
point. So yeah, trainers also good. Also
Trainers
good to
also
have.
good. Yes, also good to have. But
Okay.
anyway, back to these cars. So what one will do is they're moving within a circular range of motion and really trying to challenge that range of motion at each point. So for instance, if you were doing your neck, you might start by dropping your chin towards your chest. And you try to stretch it, feel it until you feel a bit of tension, and really challenge that range of motion. Yes, like that, Kimberly. And then,
You can do it. I want to pay
Thank
attention
you.
to Kate.
I'm trying to do it as she says it. Sorry.
yes, yes, thank you.
I'm
Thank you for
tempted, but I'm trying to
demonstrating.
look like I'm engaged. Continue.
You're both looking engaged. Okay, so we're going to drop the chin to the chest, and then you slowly, like, kind of draw a circle with your chin, and really challenge the range of motion all the way around, so that your ear is toward your shoulder. And then as you're rolling your head back, you kind of try to extend your neck at the same time. And so you're trying to stretch the vertebrae up as you're looking back. And then you just keep going around nice and slow until the other ear is towards the shoulder, and then the continue to rotate around until the chin is back down to the chest. And so you challenge that range of motion all the way around. And if you feel a sticking point, just hang there. Just hang there and let it let it kind of lessen over time. It'll loosen up a little bit. And so if it feels good, do it more, keep it there, or maybe do little micro movements back and forth a little bit through this small range of motion where you just feel it sticking.
I just had the wildest realization just now. I realized because as a swimmer, and I'm sure Kimberly has felt this
Hmm.
too, when you swim a lot, sometimes your neck will seize up and then you can't turn your
Mm.
head anymore. And I
Hmm.
have 100% done cars for my neck because I was like, all right, force it through the range of motion and like forcing my head to the side. I was like, oh
Yeah.
my gosh, I know exactly this. I have done this. I just didn't know I was
Uh-huh.
doing this.
No. So you have experienced these cars. Well, good
I
for you
have.
then. That's great. I'm a swimmer too. I've also experienced that. I guess
Mm.
if I would have realized, it would have helped me for other purposes. I would have been doing it long ago.
I
Well,
feel
now
that.
we know for the future, right?
Right. Now we know for the future. So anyway, you go all the way around and kind of a struggle. It's not supposed to be easy. You don't just whip your head around a little bit. I mean, it's really challenge it at
Mhm.
every point. And then when you get back to the starting point, then you go the other way, and that's one repetition. So each direction is
Oh.
one repetition. And the whole thing is like it's kind of fighting your way through this repetition, through the range of motion, and that creates tension. And that tension um, increases the strength at that range of motion.
Okay.
Interesting.
Because
So,
I was just gonna
yeah.
say it feels like it's not like it feels beautiful or like
Hmm.
super great. It feels like kind of clunky and I'm like, ugh, tight as I go through. So it's not supposed
Yeah.
to be like easy breezy, right?
Yeah. It's supposed to, it's hard. And
Yeah.
so,
There you
and
go.
that's a good point, because if you do a static stretch, you can kind of put yourself in that position and just kind of hang there, and it's
Mhm.
very passive, right?
Mhm.
Like
Whereas this
touching your
is a
toes.
Yeah.
Yeah.
and you just hang there for a while and it's passive. This is not passive. This is active. And so you're trying to physically stretch farther and lengthen those muscles. And each repetition, hopefully, you're going to get a little bit of a larger range of motion for each repetition.
Mhm.
And then it really does help to loosen up those joints. So you can do cars for every joint in the body, including the fingers and toes. For me, fingers and toes are the hardest ones, because toes are the hardest ones because you have to move each toe independently, and it's so hard.
I
I
don't
don't
think I could
know.
Wha-
do that.
I don't think most people can, especially because we're used to
Yeah.
wearing shoes all the time. We're used to
Yeah.
not really having I can see you trying to do that with your toes, Kimberly.
Well, what's
Sorry. I don't think I
interesting?
knew that you could. Sorry.
What's interesting is Brandon and I were having a discussion about shoes and like the argument on should we wear supportive shoes or less supportive shoes, and he's arguing that we wear so much support that we've lost our ability to do certain things with our feet because we don't have that strength anymore.
Hmm.
And I was like, oh, that's a fair
That's
point,
true.
because I'm all about support. And like, oh, I have bad ankles. I got to make sure I'm totally protected. But it's a good
Right.
point. Like maybe I have bad ankles because I'm too protected and I'm not doing the range of motion and that strengthening of those joints for that functionality anymore.
That's
Huh.
exactly right. Yeah. And that's exactly why these moving the toes independently is so hard for us, because we spent so much time in shoes. I think it would be kind of hard anyway, but it's really, really, really difficult. It might be a little bit less difficult if we weren't in shoes all the time.
I guess it
I've
makes
made it.
sense for like I can't say the name of them, but we all know shows with the shoes with little toes built into them. Uh,
Hmm. Uh-huh.
and I remember I had a friend who wore those. She's like, my toes are sore. And I was like,
Oh my gosh.
what? But it
Oh.
makes
Yeah.
sense. But it makes
Mm.
She's like
sense.
actually gripping or like
She's actually
using.
using her toes now because they're
Yeah.
they're out like that. That's interesting.
That is
That
Oh,
is
interesting.
so many
interesting.
light bulb moments for me.
It
I'm
gives me
liking
the
this.
EBGBs to think about things in between all my toes.
I know.
Anyway.
Sorry to
Yeah.
interrupt you. I'm just having these light bulb moments like, oh, my life's making sense. Continue,
Yeah.
Kate.
Yeah, no, that's really great. My new thing is I always take off
Oh,
when I'm bare feet with my shoes on, because without my shoes on, because I don't like my feet to get dirty. And so I put on sandals as soon as I get downstairs. We don't have carpet downstairs, but when I get to the stairs, I take them off and I walk around on the carpet and try to use my toes, because it is true. We have lost a lot of strength in our feet because they're always in shoes.
yeah.
I
Hmm.
Yeah, I do recommend people do some barefoot stuff if it's possible.
Yeah.
Yeah.
Anyway, so yeah, you can do these cars for every joint in the body. If you were to do a whole body routine, it would probably take about 15 minutes. Um, in
Oh,
fact, this
wow.
is
Nice.
yeah. It seems like kind of a long time for me, actually, but because it's
I think it feels like
because
a short time.
Yeah.
really? Well,
Yeah.
well, a lot of athletes will do this as part of their warm up. In fact, it's really been
Okay.
built into a lot of athletic practices just in the last few years. This has really taken off.
That's
Um,
great.
but yeah, really reaching. that end range of motion and having enough strength to work within that range of motion is obviously going to make a more powerful athlete. And so the cars can precede the other functional exercises that people do to actually strengthen in that range of motion as well before they take off and start doing their practice. So it's really good for everyone. Um, I think it may have been developed for people with arthritis. And that's the population it was originally recommended for, but it's been shown to be effective for, all populations. Improves strength within the range of motion. It improves flexibility. It really reduces pain very significantly
Which I
as one it
appreciate you mentioning, because for
yeah.
arthritis people, that would be, kind of an important
Yeah.
factor.
Yeah.
Yeah, it reduces pain, and because you have an increased range of motion, obviously the same range of motion isn't as painful, and then you get a better range of motion. You're able to do more stuff. You're really able to be a lot more functional and participate in more of the activities that you probably would like to do that you may have kind of abandoned because you haven't been able to. But it's probably easiest to do for the ball and socket joints, like the shoulder, the hip. I mean, those and the neck. Well, the neck isn't ball and socket, but it can do a rotational movement. But you can
Mhm.
even do cars for the knees. They're really hard.
I bet.
Yeah.
And you can do them for the hands and the feet. And they are kind of hard to describe in audio terms, but we are going to be recording some videos in October to demonstrate the cars exercises. There's going to be, I believe,
Great.
I think there's going to be four of us, three of us, something like that. I think four, and we're going to be recording those in October. So those will be on our website and our YouTube channel, so that people can learn how to do the exercises.
Perfect.
Awesome. That's super
Yeah,
awesome. This is all making me think of that saying motion is lotion. I feel like this is
so
like what
true.
started that.
Hmm.
Yeah,
But yeah.
yeah, that's such a good point, Kimberly, because the less you move, the less you can
Mm.
move. It
Yeah.
is really important. And so when you start having limited range of motion within a joint,
Mm.
you have a choice. You can
Mm.
restore that, or it can continue to diminish.
Yeah.
So it actually is possible to restore, at least some of the movement that we've had at one time. It takes work, but it can be done.
Yeah.
So I guess the
Absolutely.
question that I would have here is like, because we're talking about doing this, we haven't really specified how often. So like, is there a
Oh.
certain amount of this we need to do to get these benefits? Or like you said, you did it one time and you're perfect now. So I guess it's one time, right? Is that what I got? Yeah.
No, I did not say one time and it was perfect. I said one time I did it and it was much better. And
Okay.
then and so I did it another time and it was much better. Yeah. Now the ones I really concentrate on my neck mostly because it has recently been giving me the most problems. But so I do it for my neck every day. And because I'm only doing one joint, it doesn't take all that long.
Mm.
I'm keep planning to include the ones for my hands because I also have trouble for my hands. Um, but I haven't done that yet. But I'm going to because I know how effective it is. I just gotta like work it into my routine.
Evidence
Yeah.
that we too are human and also struggle with the
Exactly.
same things you all struggle with, which is
E-
doing them.
Mhm.
Exactly. We can be our own worst enemies, know what
Hmm.
we're supposed to do and just go, oh yeah, I'll do that later.
Yeah,
Truly.
but what I'm hearing though is like daily seems to be the most beneficial. Like it's not going to hurt you to do it more like once a day or anything like that.
Oh no, I would recommend doing it daily.
Okay.
Daily
Mhm.
would be most beneficial, especially if you're in a state where it's kind of inflamed and is causing you a lot of discomfort.
Mhm.
Daily makes a lot of sense as if the inflammation kind of dies down, it becomes more manageable. Maybe every other day might be fine. For athletes, I know that those that use it generally do it before preceding each workout.
Hmm.
Yeah, which makes
Nice.
sense. You will
Mhm.
obviously want to be able to access your full range of motion during your practice. So that does make
Yeah,
sense to include that.
definitely. Okay. Well, this is all interesting. Like obviously I learned a little bit about it editing some stuff, so I got to kind of get a little sneak peek at it previously, but it is good to know that this is such a benefit to like so many people. And like, is it just for people like obviously you're saying athletes and people with arthritis, like so anybody can do this, right? Is what I'm getting here.
Absolutely.
Yeah.
Absolutely. And you probably are familiar with functional training. I know you are because I've seen you applying that. Um, yes, this fits right in there, it
Mm.
with to be included with functional training to really be able to move as efficiently and powerfully as possible.
Yeah.
So, yeah, it can really affect be beneficial for anybody. Just regular Joe Schmo injury rehabilitation, injury prevention. It can be used for either of those.
Yeah, it's like the
Love that.
combination of flexibility and with that building of strength, but strength and flexibility contribute to injury prevention. So yeah, like by itself, it seems to be the perfect thing for that.
Yeah, it is. It's good stuff.
Oh, that's great. Did you have any thoughts or questions, Kimberly?
I my only thought is I was just thinking about how I was talking to Kate about this like on the side and because we were talking about like what populations it's useful for and me when I first started talking to you about it, Kate, I think I was like 7 or 8 months postpartum and I
Mhm.
couldn't even like if I my legs were straight, I couldn't even bend over forward and touch about halfway down my thigh
Oh,
because my lower back was in so much pain.
wow.
And there's like some other stuff that was going on, of course, because like whatever, pregnancy's crazy. But
Mhm.
now I've been doing the cat cow is like one of the best
Mhm.
things you can do for that lower back.
Mhm.
And absolutely it is like not comfortable and easy breezy when I do it. It's difficult, but now I can touch like about halfway down my shin. Okay. So it's been like
Yay!
Wow.
2 months and I'm not
That's
doing it as often
good.
as I should, I will say. But yeah, I kind of feel like I am a new human. It's nice to be able to bend over forward to like grab stuff. So
Oh
anyways,
my gosh. That's really
but yeah.
impressive, Kimberly. That's great. That's a huge
Yeah. Oh,
improvement.
thank you.
Wow.
I know. It's like, you don't realize the things that you're struggling with until I don't know, like some light bulb goes off or something because I couldn't even bend over and like spit out my toothpaste in the sink. So
Oh man.
so yeah, it's like it's been outrageously helpful for me.
Oh, I'm
Definitely.
so glad to hear that. Are you doing those
Yeah.
spinal
So
twists as
thank
well?
you.
Yeah,
Yes.
you
Yes. Oh,
yay,
they feel so
good.
good. Mhm.
I know at first they don't feel that good.
Well,
At
true.
first at first I know the people will while they're in that resting position with their knees over to their side, they'll be having to support their knees under a couple of cushions or something because they cannot
Yes.
relax in that
Mhm.
position. But then hopefully that range of motion improves and you
Mhm.
don't need to do that any longer. So that's great to hear,
Absolutely.
Kimberly.
Thank
Wow.
you. Thank you. I
Glad
know. I
you're
just
doing better.
wanted to attest that it works. But I know like things like lower back are or knees like
Huge.
you mentioned, like
Huge.
huge.
Mhm.
So many pain points, right? That it's like cool that there's things that we can utilize to work through it and you don't have to be like we mentioned an athlete necessarily like some of this is just like quality of life stuff too. So it's cool
Yeah.
that it can help with that.
Yeah, absolutely. And it's free and there
Yes.
you don't need any equipment and
Exactly.
you don't need a ton of time. If you just want to do one joint, it's only going to take about maybe 3 minutes,
Yeah.
If you have
Yeah.
like you had your back, I have my neck that I concentrate on.
Mhm.
If you do your whole body, it'll take 15 minutes. But if you just
Right.
have, single points, and it actually I'm pretty motivated to do my neck because it really hurts. I don't not as
Mhm.
motivated to do the rest of my body because it's okay, right?
Mhm.
As
So,
Yeah.
most people, yeah, that makes
yep,
sense.
Mhm.
yeah.
Problem area only. Done. Yeah, and I think it's worthwhile just for anyone listening at home too to recognize like we talk a lot about flexibility in our classes at Positive Choice in terms of the importance of it, but it's not just like touch your toes and stretch. Like sometimes flexibility actually involves strengthening, like cars. And we adapt as human beings really easily to feeling uncomfortable all the time. We're actually used to feeling pretty crummy a lot of the time. And it's amazing when you do something that makes you feel better. You're like, is this what it's like? Is this how it feels to
Mm,
not hurt? Oh my gosh.
Yes.
And just
Yeah.
mhm.
something to take into consideration that you may say, like, oh, I have no flexibility. It doesn't mean you can't.
That's right. That's right. Flexibility
That's
is a
good.
trainable skill, just like all the
Mm-hmm.
rest of them, like
Mm-hmm.
balance and strength and cardiovascular. It's all trainable. We can all get
Exactly.
better.
I love
Exactly.
that.
So
Yeah.
don't use it as a means of getting out of it just because you say, well, I can't do it. Well, you could.
Yeah.
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 Yeah, we all have maybe you don't have the range of motion that somebody else does right now yet,
Mhm.
in the
Yet.
great
Mhm.
words of our great Carol Dweck. Have you heard
Mm-hmm.
of Carol Dweck?
Mm-hmm.
Yeah, yeah. Can I just mention who she is for the listeners?
Yes, please.
Yeah.
Okay, Carol Dweck, she's a brilliant social scientist at Stanford University, and her gig is on mindset. And her one of her great sayings is when people say, I'm not good at that. At the end of that, you say, yet. Not good at that yet.
I like it.
Because we can get better.
Exactly. Someone quoted Carol Dweck in one of my classes last week, actually,
Mm.
funny enough.
No
That is
Oh,
way.
funny.
That's
Yeah,
amazing.
because
she's
That's how I
brilliant.
they did
Love
the
first.
her.
yet. Carol Dweck.
Hmm.
I was like,
That's
Yeah.
how I
oh,
first learned about her. Was a patient in class told me that the
Really?
yeah.
yet. Yeah.
Yeah, she's pretty popular. That's
I
funny
like
that
Yeah.
that.
I love it when we learn from our patients. They're all
I do
so
too.
smart.
It's so
Yeah.
great. It's true.
I love it.
Yeah.
And, I love all knowledge. Teach me more things, right? Which is why I love
Yeah.
this. I love this
Yeah.
conversation because, yeah, it's
Yeah.
cars, something new that, I've been in this field for like 10 years or so, give or take,
Hmm.
and never once until recently had I just heard of it. Like 2 months ago, I learned about this. So
Hmm.
Wow.
it's been a fun ride to learn new things, even everything. Like you said this best about nutrition, Kimberly, this is an ever evolving organism. I would say it's
Yeah.
arguable with the same with
Oh
fitness. We
yeah.
we
Oh,
continue to
sure.
learn and improve on what we already know.
I love
Yeah.
that. It's true. The
Yeah.
body is like such a cool thing, right?
Yeah.
I
And we
agree.
still don't really understand it. People don't
Yeah.
get that. Like we still don't really know what an appendix does, but we're still pretending like we do.
Right.
Uh,
That's
like
great.
I always like to use the argument with people because, like, even if things change, because you might hear this and be like, wait, I was told by this person to do this. It's like, just know things change with the research and what's indicative of what's going on out there. And we constantly have to adapt and adjust to what's the new standard, what makes the most sense, what's most safe for you to do. And I'm liking
Mhm.
cars, and hopefully like it becomes more mainstream, at least within our field, because it feels like it's there, but maybe more in the therapy world. I'm not sure, but
Hmm.
it's definitely not
Right.
bled too heavily into our field yet. Haha.
Hmm. Yes,
Call
there you
back.
go.
Call back.
Love that.
Nice.
That
But
was a good one.
anyways, unfortunately, it's about that time. We must go. But thank you so much for being here, Kate. It's been so
Yes,
fun to
thank
have this
you.
conversation. Is there any final thoughts or things you want to say about cars before we wrap up?
Gosh, what else do I want to say about cars? No, I'm just gonna say, please, in
Please do then.
October. No, well, I mean, please in October search our YouTube channel because we
Hmm.
will have examples of all the joints and how you actually do the exercises. Because um, yeah, it helps to have
Okay.
some instruction. So that's what
Yeah.
I would say about cars. And thank you guys for having me on here. I'm honored to be here.
Of course, we're happy you're
We're
here.
excited.
Thank you for being here. Thank you for educating us. I love this.
Oh, my
Um,
pleasure.
and then for everyone else at home, make sure you like, share, subscribe. If you're on YouTube, you feel free to comment below. But aside from that, until next time, everybody.
Bye.
Bye.
Bye.